Hello, it's Bill, the knee pain guru. Welcome to the Ask Dr. Beck show. Welcome, Dr. Beck.
Good morning, Bill. Good morning, everyone.
Good morning. Good morning. How have you been?
I'm still on this side of the daisies, which is good. The flowering side.
Okay, good. We skipped last week because, well, schedules just got kind of nutty.
Yeah, I had to work.
Yeah, well, it happened, and we had Thanksgiving.
Every once in a while. Yeah.
You have a good Thanksgiving?
It was interesting. Yeah, that's what I can say. It was interesting.
A lot of turkey?
Nope.
No turkey.
No turkey at all. No Thanksgiving meal.
Well, okay.
In the traditional sense. I mean, did eat dinner, but nothing fancy.
I had friends who had sushi on Thanksgiving.
Oh, that sounds good.
It does sound good. We have a couple of questions that came in. Let me locate one of them here. This was from. We still got to get around and talk about the mouth, don't we? We were kind of working on that. This was several weeks ago.
Yep.
And we'll get to that. Oh, the Nadine Artemis. That little video clip. I sent you a little video clip. I want to get into that in a little bit. I thought that was, I'd never heard anybody talk about the teeth in that way other than you. So I was kind of stoked about that. Okay. We have a question here from, and before we read the question, there's a few people watching. If you have questions, like to ask Dr. Beck a question, you can submit that in the live chat or the comments section if you're watching the replay, and we use those on future episodes. Okay, here we go. Let's see. Melissa writes, Dr. Beck, how would you compare chiropractic and osteopathic hands-on techniques? I know.
I don't think there's a more loaded question than that.
Could be.
Yeah, so let me see if I can tactfully answer.
I could try.
Okay.
Maybe we could talk about viruses.
Oh, yes, that would be far easier.
Okay.
Less landmines involved.
Okay.
Okay. So first of all, let me start off by adding in that no matter what the profession, you're going to have people who are very talented and very good at what they do, and people who, despite how much they try, aren't going to get good results, and you might look at them and think that they were not qualified, et cetera, whatever your brain goes to. Mm-hmm. So keeping that in mind, that in this case, both professions, osteopathic and chiropractic, there are people who are exceptionally gifted, and then there are people who probably shouldn't be putting on Band-Aids. I'm going to give you an answer.
Okay.
So we have to start with history.
Okay.
And the history in this country, in the United States, is that osteopathy came around first. First, the idea originated in 1874 with Andrew Taylor Still. He was a Methodist circuit minister, a farmer, an inventor, a father, and a physician. And at that time, in order to become a physician, you either went to 1 year of medical school or you apprenticed with a practicing physician for 1 year. Things have changed since then, but that's the way it was at the time. So Still was a physician. He lost a wife and at least 2 children. There's some references that say 3 to spinal meningitis in the course of a month. And even today, spinal meningitis is something that we give supportive care for. And being a physician, he kind of asked all of his friends and said, hey, what can we do? And well, there wasn't much you could do back then. This was before the advent of even IVs, and there were no antibiotics. So this is when doctors still practiced out of the little black bag. And, you can imagine losing a big chunk of your family all within a month still is pretty distraught.
Mm-hmm.
So nobody really knows how the idea that the body is a machine got planted within Dr. Still. But he begins to think of the body as a machine, and like a machine, because he was an inventor, if things in the machine worked, then the machine worked flawlessly. If things in the machine didn't work, then the machine didn't work properly. And in theory, you could find a part and replace a part, and the machine would work again. So he thinks about this like the body, and he says, if everything in the body is working correctly, then the body works, and there is no place for disease. He names this after osteon, which is bone, and pathy, which is the suffering of. And so osteopathy literally means the suffering of bone. Starts working with this idea, spends about 30 years trying to figure it out, and finally winds up in Kirksville, Missouri. Let me close the door here. Hang on a moment.
And I'll take this moment. If anybody has any questions for Dr. Beck on their specific situation, please enter those in the live chat.
Yeah. So he finally winds up in Kirksville, Missouri, which is still today in the middle of nowhere, and opens the first osteopathic school, the American School of Osteopathy, in 1892. That first entering class had women in it. I want to say that we beat Harvard by a year in accepting women into medical school. And we were the first to accept African Americans. So osteopathy has been progressive from day one. So then in 1895, a gentleman by the name of Daniel David Palmer from Davenport, Iowa, comes to Kirksville, spends a couple of weeks with Dr. Still getting treated. The history says they had dinner at Still's table with Dr. Still and his wife. And then a year later, D. Palmer in Davenport, Iowa, invents chiropractic.
Mm-hmm.
So that's the history. If we look at where we are now, osteopaths, unlimited license to practice medicine in all 50 states, chiropractors, limited license to practice what they do. So chiropractors can't prescribe all drugs. There are lab tests that are unavailable to them. They can do x-rays. And, that's really the history. We also approach the patient differently. And it's almost up to the individual. It's probably unfair to go into that because, again, some chiropractors are exceptionally good at what they do, and some osteopaths are not good at what they do. So unfair to compare those two, but that's the history.
I mean, my own personal experience, I've had conversations with DOs that I was like, "Are you sure you're a DO?"
Mm-hmm.
So I mean, I've seen it.
Yep.
Exactly what you're saying. You have to take it by the individual,
Yes.
who they are. And that same thing, I've had that experience in martial arts. Which is the best martial art? Well, how's your teacher?
Exactly.
Really,
So
you got to look. So, let's see. She goes on to Melissa continues. I know you are a highly trained and experienced physician, so you will bring much more to the table when treating your patients than a chiropractor would. I am wondering about the actual hands-on techniques. That's how she finished that. Anything else you want to add or avoid?
Well,
anything to add or avoid?
There's lots to add there. So chiropractic is a spinoff of early osteopathy. As Dr. Still got more experience treating folks, his methods that he used to treat changed. Mm-hmm. And chiropractic is a spinoff of the early part. So what's interesting is the use of the word technique. Many, many people use this. To me, that's the use of that word is a hanging offense, only because a technique means We're going to move the body part this number of degrees. We're going to apply this many pounds of force. We're going to do this one thing the way that we learned it. We're going to ape the people that taught us this, and we are going to expect it to work every single time.
Mm-hmm.
And in the real world, that doesn't work. That's why you have to get a craftsman to make something. Someone who can take the individual item you're working with, understand how to work with that item to create something that is beautiful, aesthetically pleasing, functional, whatever word we're going to use. The body's no different. So principles is what I use to treat someone, not techniques. You can use the principles and get infinitely variable applications even on the same patient. So that's a big difference between at least the osteopathy that I was trained in and chiropractic. Chiropractic uses techniques. That's what the terminology that they use. It is often used in osteopathy, but the good osteopaths practice principles.
Yeah. I think you can get too stuck in technique. You get
Correct.
stuck in technique, and then you lose the person.
Correct. Yep.
Okay. Well, we're gonna tag Melissa. I know what kind of questions she asks.
They're good questions.
Yeah.
Fraught with landmines, but they're good questions.
Yeah. Okay. We're highly skilled enough to navigate and negotiate those. Okay.
Yes.
Okay, let's see. Dwayne writes, they did the second knee 2 months after the first. Okay, so the title of the post, this was a post that was on the Comella Foundation website. How long does knee pain last after knee replacement surgery? So that is the
Got it. Yep.
blog post. Now, Dwayne writes underneath that, they did the second knee 2 months after the first. I was in the hospital one night each time. First knee healed at a fantastic rate. The second knee is a little slower, but doing well. I don't need crutches or any rehab, walking around okay, have full range of movement. I think I'm luckier than most. There was never a lot of pain. And from your perspective, is that a function when they say they don't feel any pain? Is that a function of they really don't feel pain, or there's a level of awareness of what was going on that they're just not dialed into?
Good and interesting question, the way that you worded it. For some people, you get, and let's back up for a moment. Lack of proper motion equals pain.
Mm-hmm.
Okay. So if a joint or joints aren't moving properly, the body will give you the sensation of pain to help limit that bad motion so that you don't wind up hurting yourself.
Okay.
Okay. And so if we get surgeon who is technically proficient at what they do and understands the body in such a way that they're able to give the body what it's asking for, then you can have surgery, come out of surgery and feel absolutely amazing because everything moves. The surgery did what it was exactly supposed to do.
Mm-hmm.
If we take even the same surgeon on what they might consider an off day and something isn't working mechanically right in the body, then still a good surgery can leave you in pain afterwards because things aren't working correctly.
Interesting. I hadn't thought of or considered that or looked at it that way.
Right.
Yeah.
So with the knee, one knee healing great, good day, good surgeon. Second knee not doing the same as the first, then there may be some things in the body that need to be addressed, and probably not surgically.
Mm-hmm.
But you can get that knee to work better by removing the hindrances that are keeping it from healing.
Yeah, I kind of cringe a little bit when I hear people double downing on surgery. Well, the first surgery didn't work, so I'm going to get another one.
Yes. Yep.
And
Yep.
well, then they go for the third.
Yeah.
Okay. We have a question that came in from Kathy. Kathy says, is the osteopathic help for lumbar?
No.
Am I back?
Yeah, you were never gone for me. Okay, so let me answer the questions as asked. Lumbar foraminal stenosis. So then what we've got to do is we've got to understand what's going on from our choice of words. So lumbar spine, those are the 5 vertebrae that are in the lower part of the back above the sacrum. Foramen is the hole that the nerve root comes out, and stenosis means narrowing of the hole. The narrowing of the hole is most often a bony narrowing. So we had an opening that was 1 diameter, the bone grows and makes that diameter smaller. Okay. So that's our setup. There's a nerve that goes through the hole. The nerve originally had lots of space. When you get a narrowing, it has less space. So there are 2 thought processes to take into account when we look at how we can help that. One is we can go through and open a window into that place where the bone is growing. And we can use basically a Dremel tool, like a burr, and we can increase the opening size. Now, so that's great. It works. It carries the risk that by taking down that bone, the bone is going to respond by putting down more bone where the bone is now missing, and you get a reoccurrence. So that is a possibility, but it is one option of treatment. What we learn is as that bone grows and it puts pressure on the nerve itself then begins to swell. As it swells, it then takes up space in that now more narrow opening. And so what you can do is something called perineural therapy. It's also known as neural prolotherapy. Different than prolotherapy itself. This uses typically a 5% sugar solution in water. So it's D5W. Or you can use mannitol at 5% M5W.
Mm-hmm.
What that does is it helps the nerve to become not irritated and go back to normal size. So you may have a narrow opening, but if you have a nerve that fits within that narrow opening and it doesn't have a problem moving around, the stenosis isn't giving you a problem. It's like an incidental finding.
Oh, like raise the bridge instead of lowering the river kind of deal.
Yeah, correct. Exactly.
You just look at it. And...
Yep. Okay, so prolotherapy in this case, prolo means to grow, to proliferate. So you actually don't want things to grow in this case. You want things to shrink.
Mm-hmm.
So the concept of prolotherapy is a good one, but in that particular application, it would not be the thing that I go to. Will prolotherapy also help a benign tumor on the spinal nerve root? So if there's a tumor, we try to figure out what caused the tumor. Was it something mechanical? Was it something chemical? And then can we help the tumor by changing something in the body? My thought process here is prolotherapy causes proliferation. It causes growth. And so would I want to be putting a needle in or around a benign tumor, stimulating growth? And potentially that benign tumor could become malignant. It also could cause the benign tumor to grow. So again, I would say wouldn't be my first choice.
How might you approach that situation with a benign tumor?
If it's a benign, so benign simply means no cancer. which
Okay.
basically means that if it's not causing you problems, we don't need to worry about it. If it's causing you problems, then are those problems mechanical problems? If
Mhm.
they're mechanical problems, can we treat those with our hands?
Mhm.
Or do we need surgery? Do we need intervention to take that tumor off? And if we decide to go the intervention route, then you've got to look at, can the tumor be accessed safely? Can it be safely removed? Are there going to be consequences of removing it so that you can make an informed decision about whether that's the route you want to go?
Mhm. Got it. Makes sense. Uh, let's see. That was good. Kathy continues to write. It's all in the same area of the spine. Seems to be like this is all kind of connected. There's an intersection of what she's.
Yeah, and so then what I would think from the aspect of tensegrity is that there was likely some trauma to this area of the spine at some point in the patient's life. And you get now the manifestation of things not growing the way they're supposed to. So it would be a hunt for, can we remove whatever trauma it was? And then at a minimum, will it keep things from progressing? And at a maximum, will it help things to turn around?
Mhm. Okay. Um, those were all of the questions that came in. Oop, screen just went a little crazy. Those are all the questions that came in. Uh, did you let's for a few minutes that Nadine Artemis
Yep.
video that I sent you, and I will look. I sent you that by text,
Yes.
wasn't it? Yeah. Okay. So I'll post the link to that. It's a promotional video clip for I believe, a podcast by Sean Stevenson. Uh, he interviewed this Nadine Artemis, and she had said she was sharing some information in that promo video that was really interesting in terms of looking at a holistic approach to tooth health.
Hmm.
And if you wanted to touch on that a little bit.
Yeah. So I learned that the teeth had an axoplasmic flow. Basically, think of it like a river that's flowing from inside the tooth to the outside, and that pushes the bacteria out. That's the terminology that I use.
Mhm.
Nadine says there's a lymphatic flow. All right, not so different, just different words. And that lymphatic flow is designed to keep the teeth healthy. It flows from the inside to the outside. And that when teeth get unhealthy, the lymphatic flow is disrupted.
Uh-huh.
And so that makes perfect sense. We're using different words for the same phenomenon, is what it sounds like. And then what you want to do is figure out how to get those teeth to where they are lymphatically doing what they're supposed to.
Mhm.
And that was the big thing that I got from her.
And was she coming at it from specifically a nutritional perspective? Or I didn't get a structural pardon?
I've slept 3 times since then. I don't know. I don't remember.
Oh, okay. Well, what I'll do, I'll get the link. I'll
Okay,
post it in there. I'll find the podcast from Sean Stevenson. I'll post it in the description of this video.
perfect.
And so people can check that out, and then we can touch on that.
Yeah,
I'll send that to you as well, and we can touch on that next week.
yeah,
Go in a little deeper on that to kind of figure out axoplasmic flow or lymphatic flow or nutritional or structural or whatever it is. Because I find this stuff interesting when we can kind of take things and
yeah,
connect it
yeah.
together in a universal way that people could go, oh, I could take care of my teeth that way. That makes sense.
I was looking at a blog or a Facebook post yesterday, I think, on fluoride and teeth.
Mm-hmm. Mm-hmm.
And it's an interesting conversation where there is naturally occurring fluoride.
Mm-hmm.
It occurs in the water table in some locations, but not. And I want to say fluoride, if I remember correctly, can have two valences, one a valence of 3 and one a valence of 5. It's the electrons in the outer shell. And I'd have to look up my chemistry past that because I don't remember which one is which as far as being easier to make a molecule with and which one is more complicated. But the way it works is fluoride itself is a waste product of the aluminum smelting industry.
Yes.
So it is a hazardous waste that they have figured out brilliantly, if you're in the industry, how to not just dispose of the waste, but sell it and make a profit to municipalities who can put it in their water supply. Because fluoride is supposed to make the teeth stronger. Well, here's what happens. So we talked a few episodes ago about thickenings at the edge of a bone, which basically is called a buttress. And fluoride, when it binds with something, is one of the strongest bonds in nature. So that's why you can make a non-stick coating, which is a fluoride-based coating. We basically make a molecule. We figure out how to get it to adhere to something like a piece of metal, like a pan, and then things don't stick. That bond, though, is incredibly strong. And so other things tend not to be able to break that bond. And so if fluoride is one of the things that binds in bone, you're not going to get it easily displaced. And it tends to be at the edge of the bone, which makes the edge of the bone brittle. It's not as resilient as it was without the fluoride. And so fluoride over time, especially if you're female, is going to predispose you to hip fractures. The hip bone becomes more brittle.
Specifically bone, or is this?
It goes everywhere, right? It goes everywhere. But as you get older, that hip bone is where we see fractures showing up. Okay. Through bony remodeling, through aging, all the things that happen. It's just that with the fluoride, the bone becomes more brittle, and so it will break instead of flex and bend. But the same thing happens in the teeth. The teeth can become more brittle. You can also have something called dental fluoridosis, and the teeth become mottled, different shades of white, because of the fluoride on the surface of the tooth. So, since I read about that, and it's probably been 10 or 12 years ago that I really kind of did a deep dive, read all the books that I could find on fluoride in teeth. There's a book called The Fluoride Deception, which is about 500 pages. And again, as I remember, it was a fascinating read. But my take on it from a personal perspective was fluoride is not necessary for tooth health. And so again, at that time, 10 or 12 years ago, I'm like, all right, I'm not going to use any more fluoride for the remainder of my life. I'm just not going to use it. And that's been personal choice. Not saying that everyone should adopt the same thing, but they should gather information and then make the choice that in their mind is wise for them.
It's an interesting piece on this is I made a very similar choice. So you make a choice that's different from the mainstream, what everyone else is doing, but then you have issues with your teeth or otherwise, and now you begin to question yourself.
Of course.
Is the mainstream really right? Or am I going down the right?
Exactly.
So what you find out anything around that?
So when you look at, and this is where in the current world environment, science has kind of gone the way of politics. So the science will change based upon the wind direction. And if you have a storm, remember that the wind goes 360 degrees over the course of a storm. So I go back to scientific method. We when we're doing an experiment, we change one thing. We see what that one thing did. We make observations. We make notes. We change a second thing. We don't try to change more than one thing at a time until we figure out what each one thing will do. So the idea here is that fluoride itself makes the teeth harder. That's what it does.
Okay.
And it will likely not have an influence on, let's say, cavity production. If the teeth are healthy, then theoretically you should be able to eat pretty much whatever you want to and not have cavities. If the teeth are unhealthy, or if the mouth is unhealthy, then what is causing the unhealth in the mouth? Is it the food that we eat? Do we follow the idea that it's a few different microbes that are growing on the sugar that are sticking to the teeth that are causing the problems? Because it's one explanation and there's science behind it. Do we look at it from a different perspective, and your throat chakra is about your ability to literally speak your truth? Well, that's an equally valid concept. And if your life is not, you're not following your path, you're not speaking your truth, could it be the body's way of sending you a message? Hey, you need to look at this and figure out what's going on. It's equally valid, even though it may not be completely science-based. Is there trauma that you're holding in your body? And it could be oral trauma. It could be that you got hit in the mouth, for example. And what I notice is, I mean, even as osteopaths, we don't talk about that. You know, how many of us in learning how to walk saved our face and never fell face down? And there may be some, but it's not all of us for sure. And is that trauma that goes into the head when you hit your mouth on whatever it is that you fell on when you were learning how to walk? Is it still there? And I think, yes, I feel it with my hands sometimes, but it's something that we completely don't look at in dentistry or in osteopathy for that part. So could it be playing a role? You know, and then you look at growing up and you learn how to ride a bicycle. So you probably fell off, hit your face again. You may have been in a bar fight or something like that, you know, falling off a swing set. The things that we do in life, we bounce back, we get up from, and we think, oh, no big deal. I'm not hurt. I don't need to go to the hospital. So nothing happened. But from a physics perspective, that's not the case. Something did happen, and it may or may not have ramifications that we see later in life. So those are the things that I look at, and I don't know the right answer. It seems to be different for each patient. But if we start exploring the questions, then your life history may lead us to selecting the right answer for you.
I have to chuckle when you're describing that, because I remember when you were working out of Southern Indiana and I came to see you for an appointment.
Yep.
You're like, did you get punched in the head? Well, yeah. So, but it was good.
Yeah.
It was good. But that's what we got for today.
Cool.
How about that? For those that are watching a replay, we should do I forgot to do the promo thing. Let's do that real quick.
Promo.
Let me find it.
Our mission at the Comella Foundation is to relieve pain naturally using osteopathic healing principles. The Comella Foundation is recognized as a nonprofit 501c3 under the Internal Revenue Code. Your contributions are greatly appreciated. Please consider taking a moment and donating to the Comella Foundation to help us continue our important pain relieving work. Every little bit helps.
And here we are. How about that?
Cool.
Well, cool. That's all we got for today. Charlie, thank you so much for your time, your expertise. sharing your knowledge. And we'll be here on the same time, same channel next week. Thank you. Thanks, everybody, and we'll see you next time.